Hi everyone, welcome back to the channel. Today we're diving into a topic that's super important for your health: colon cancer. Now I know it's not the most glamorous subject, but trust me, it's crucial we talk about it. Colon cancer is one of the most common cancers out there, but the good news is, it's often preventable and treatable, especially when caught early. We're going to cover 8 critical colon cancer symptoms you absolutely cannot ignore. Recognizing these signs could be life-saving, literally. So, let's break down these symptoms and empower ourselves with the knowledge to take control of our health. First up, let's talk about something we all experience: bowel movements. They might not be the most pleasant dinner table conversation, but paying attention to your bowel habits is essential. We're talking about persistent changes, and I mean changes that last for more than a few weeks. Have you noticed a sudden increase in diarrhea? Or maybe you're struggling with constipation more often than usual? How about the consistency of your stool? Is it much harder or looser than normal, or even a different color? Look, I get it. Our diets and stress levels fluctuate, and that can definitely impact our bowel movements. But if you're experiencing these changes consistently for an extended period, it's crucial to consult your doctor. Don't brush it off thinking it's nothing. It could be something as simple as a dietary sensitivity, or it could be a sign of something more serious. The key is early detection. Remember, your doctor is there to help you understand what's normal and what's not. Don't be embarrassed to bring it up. It could literally save your life. Okay, this next symptom is a big one: blood in your stool or rectal bleeding. I know it can be alarming, but remember, knowledge is power. Now, before you jump to conclusions and assume it's just hemorrhoids, listen up. While hemorrhoids are a common and often benign cause, blood in your stool should never be ignored. Whether you notice bright red blood, which usually indicates bleeding closer to the rectum, or darker, almost tar-like stools, which can suggest bleeding higher up in the digestive tract, it's essential to get checked out. Colon cancer can cause bleeding as the tumor grows and irritates the lining of the colon. Early detection is key here. The sooner we catch it, the better the outcome. So please, if you notice blood in the toilet bowl or on your toilet paper, don't hesitate. Schedule an appointment with your doctor. They'll be able to determine the cause and provide the appropriate treatment. Let's talk about symptom number 3, frequent abdominal pain or cramping. We've all experienced stomach aches, but this is different. We're talking about persistent pain that just won't quit. It might be a dull ache, sharp cramps, or a feeling of pressure or bloating. If you're experiencing this type of discomfort regularly, and it's not your typical indigestion or gas, it's time to pay attention. Colon cancer can cause abdominal pain in a few ways. A tumor can obstruct the bowel, leading to cramping and pain. It can also irritate the lining of the colon, causing discomfort. The key is to listen to your body. If something feels off, don't ignore it. Keep a symptom diary and talk to your doctor. They can help differentiate between a simple stomach bug and something more concerning. Early evaluation is always better than waiting for the problem to worsen. Alright, this next symptom is a bit stealthy: unexplained weight loss. Now, I know many people might be thinking, what's wrong with losing a few pounds? But hear me out. While intentional weight loss through diet and exercise is fantastic, unexplained weight loss, meaning you're losing weight without actively trying, can be a warning sign. If you notice your clothes are fitting looser, or the numbers on the scale are dropping without any changes to your lifestyle, it's essential to consult your doctor. Colon cancer can lead to weight loss for a couple of reasons. First, as the tumor grows, it can affect your body's ability to digest and absorb nutrients properly. Second, cancer cells are notorious for consuming a lot of energy, leading to weight loss. So if you experience significant, unintentional weight loss, don't dismiss it as a positive side effect. It's crucial to get to the bottom of it. Let's talk about fatigue and weakness. We all feel tired from time to time, but persistent fatigue that sticks around even after a good night's sleep could be a red flag. If you're constantly feeling drained, like you just can't shake off the exhaustion, it's essential to pay attention. This type of fatigue goes beyond just needing an extra cup of coffee. One possible link between fatigue and colon cancer is iron deficiency anemia. Colon cancer can cause slow, chronic blood loss within the digestive tract, leading to iron deficiency. Iron is crucial for carrying oxygen throughout your body, so when you're deficient, you feel tired and weak. Other symptoms of anemia include pale skin, shortness of breath, and dizziness. If you're experiencing persistent fatigue, don't brush it off as simply being overworked or stressed. talk to your doctor. They can run a simple blood test to check your iron levels and rule out any underlying conditions. This next symptom might seem a little strange, but trust me, it's worth paying attention to: the shape of your stools. While it might be TMI for some, consistently noticing narrow ribbon-like stools could be a sign of something going on in your colon. Think of your colon like a pipe. If there's a partial blockage like a tumor, it can compress the stools as they pass through, resulting in thinner ribbon-like poop. Now, this doesn't automatically mean you have colon cancer. Other conditions like irritable bowel syndrome can also cause changes in stool shape. However, it's crucial to rule out anything more serious. So if you notice this change in your bowel habits, especially if it's persistent or accompanied by other symptoms we've discussed, don't hesitate to reach out to your doctor. Ever get that feeling like you haven't quite finished going to the bathroom even after you just went? This sensation, known as tenesmus, can be another symptom of colon cancer. It's that frustrating feeling of needing to strain or having incomplete bowel movements. It's like your body is telling you to go, but nothing else comes out. This discomfort can occur when a tumor is located in the rectum, close to the anus. The tumor can partially block the passage, making it difficult to fully empty the bowels. While tenesmus can also be caused by other conditions like constipation or hemorrhoids, it's crucial to rule out anything more serious, especially if it's a new or persistent symptom. Don't suffer in silence. Talk to your doctor. They can help determine the cause of this discomfort and recommend the appropriate treatment. Our final symptom today might surprise you: iron deficiency anemia. You might be wondering, what does anemia have to do with colon cancer? Well, it's all connected. As we discussed earlier, colon cancer can cause slow, chronic bleeding in the digestive tract. This bleeding can lead to a gradual loss of iron, which is essential for producing red blood cells. Red blood cells are responsible for carrying oxygen throughout your body. When you don't have enough iron, your body can't make enough red blood cells, leading to anemia. Symptoms of iron deficiency anemia can be subtle but include fatigue, weakness, pale skin, shortness of breath, dizziness, and even cold hands and feet. If you've been diagnosed with iron deficiency anemia, it's important to work with your doctor to identify the underlying cause. Don't hesitate to ask if further testing, like a colonoscopy, is necessary. So there you have it, 8 critical colon cancer symptoms you absolutely cannot ignore. Remember, knowledge is power when it comes to your health. If you experience any of these symptoms, especially if they're persistent or severe, please don't panic, but do schedule an appointment with your doctor. Many of these symptoms can be caused by less serious conditions, but it's crucial to get checked out to rule out anything serious. Early detection is key when it comes to colon cancer. Screening tests like colonoscopies can literally save lives. They allow us to detect polyps, which are small growths in the colon that can sometimes develop into cancer, and remove them before they have a chance to cause any harm. Remember, your health is your greatest asset. If you found this video helpful, please share it with your friends and family. It could save a life. And don't forget to hit the like button, subscribe, and turn on notifications for more health tips and updates. Together, we can spread awareness and empower each other to take control of our health.